medial malleolus is part of the tibia. Find the lateral malleolus. Come up and find the head of the fibula. This is why I like to do the videos on my own, because I go back in a...
Sounds like you know what you're talking about.
Wow, she did it on the first take. Take 10. I also like to go up with the web of my hand and go up underneath the tibial tuberosity. Get an idea of how the knees look. Here's the patella. When the knee is in full extension, meaning straight, the patella should be able to slide back and forth. It's a little freaky, but the minute you put the patella under tension, you can't move it. So this is a great example. I can move the patella, and now I really can. Place your hand underneath the knee, the posterior part of the knee, and see if there's any space. Some people have tight muscles and they can't fully extend. So you get a sense of how much space is behind the knee. So you can come up to the head of the fibula and the lateral malleolus, take a pincer grip, and you can mobilize the fibula.
Really?
It's a great technique. It's great for the knee and it's great for ankle, especially if you have swelling in either joint. This is the femur, your big thigh bone. And what is this bony landmark here?
Greater trochanter?
Greater trochanter. Aren't you glad? So when I'm poking around on my client, instead of just greater trochanter, I like to start in the middle of the thigh and then work my way up with the palmar surface of my hand. And that way it's not that much of a surprise, because now I'm getting into some dicey area. I'm not going to be working midline, but I still want to have that respect. And there can be some tight spots or some sensitive spots. You also don't want to be poking in and create pain. So I'll find the greater trochanter. You can find them on both sides. This is a big area for muscle attachment. Then when I'm here, I'll come up and put my palm of my hands on the iliac crest. And when I come all the way forward, I can feel a point. And this is called
Anterior, superior, iliac.
spine. Anterior superior iliac spine, ASIS. Now I'm going to put the ASIS right in the middle of my palm, and I can do a little bit of a pelvic rock. I'm going to scoop up underneath the ASIS, and I can measure whether the hips have any torsion in them at all. So scoop, just get a sense of where this is. Now I'm going to come up into the rib cage for women. Obviously there's breast tissue that you just don't want to be grabbing onto. That's for other times, not here in class. But you can access the lower part of the rib cage. Have an awareness of how much space is between the lower rib and the top of the iliac crest. On some of us, you can really tell. On some others of us, there's a lot of tissue in there. It's not a judgment at all, and you'll be able to feel it more in the back than you will in the front. But this will also help determine whether you may be all level here in the pelvis on down, but you might have some kind of side bend or torsion, rotation going on in the upper body. Touch the sternum, get an idea of where the sternum is, midline. Breasts will fall apart, so you're not going to be touching anything. I know it's a little scary at first, but you go in with that therapeutic intention, and you can ask permission. Is it all right if I access your sternum now? And just tell your client what you're going to be doing. So find the sternum, because later on, when you get into practice, you'll want to mobilize the rib cage, and this is a great way to start, is by finding where the sternum is. Palpate the clavicles, and then we'll go to the head. Actually, can you help me move this out? Beautiful. And do you remember the name of the bone that is the back part of the skull?
Occiput.
Occiput. I want you to just cradle the occiput. You don't need to dig inside the neck at all. Just cradle the occiput. Feel where the occiput ends and the tissue begins. As you can see on Lucy here, there's a good 2 inches from the base of the occiput into the vertebra. And actually right here is where muscles start to attach. So you've got about 2 inches of tissue to get through. So when people say, oh, I'm in those suboccipital muscles, you're probably not right off the bat. But cradle the occiput and then just apply a little bit of traction. Just enough so that you're putting traction on the neck only, the cervical spine only. If I'm yanking, I'm tractioning the whole body, and whoop-de-doo, it doesn't really do a whole heck of a lot. That'll be good for supine, so cut